Joining us in studio this morning, I'm going to get this out eventually. Sarah East is back with us with Lovelace Regional Hospital, certified physician's assistant. Good morning.
Morning. How are you?
Doing great. How about yourself?
Very good. I appreciate you letting me back in here again.
It makes it sound like we don't let you. Hold on. Who are you again? No,
Yeah.
it's a pleasure to have you back.
Thank you.
So for folks, if you don't remember our last conversation, you deal a lot with folks that need. What don't realize or may not realize, but Botox, things like that. Most people think Botox, they think of wrinkles and
the cosmetic
side.
side.
The cosmetic side of things, which if I remember correctly, originally Botox came out to serve as a headache for migraines.
Yes.
Which it does do.
Yeah, and that was the main thing that we talked about last time was the migraine portion of the therapeutic Botox.
Yeah.
And then since then, they've kind of expanded it to other therapeutic reasons, which is what we're here today.
Yeah, so Botox is kind of a wonder medicine in many aspects where many people use it for was just one of those, hey, it just happens to do that too. That's not what we designed it for, but
and you're like, wow,
bonus.
look at how pretty her forehead looks now. Let's start using it for those wrinkles.
But so it was a happy accident, as Bob Ross would once say here on this. But really, what it sounds like is they're actually finding out even more stuff that they're saying. You know what, Botox is kind of has ability to do more than just headaches and make wrinkles go away here.
Yeah.
They're helping with, I'm guessing, perspiration control, things like that.
So a couple other things that we use therapeutic Botox, which is what I wanted to kind of bring to everybody's attention today, is what you were mentioning just now is what we call hyperhidrosis.
Okay.
And that's where you have excessive sweating, primarily armpits, hands, the bottom of your feet.
Okay.
That really can affect a person's life because they're embarrassed because they're always sweating. They have the wet stains under their armpits, and they don't want to go do anything because they're embarrassed. So we found that Botox helps with that. Also for patients who have had strokes in the past, and they can get spasticity of their arms and their legs to where they're having chronic flexion of their arms, like at the elbow, the wrist, the fingers. So we found Botox helps with that as well.
Oh, wow.
And then also for TMJ, where you get the locked jaw or the pain when you're chewing, we put Botox in your masseters and temporal muscles, and it calms the TMJ down as well.
And it keeps it from locking up as often or having the pain and those other issues associated with TMJ.
Yeah, so there's lots of good things about Botox as far as the therapeutic side.
Man, what's next? Like they're going to go, it's great in salad, too.
Yeah. Just don't mess with the burritos.
That's right. But that is cool that it really is a kind of a mini wonder drug in many aspects here. Whether if you need it as more of a just a self-esteem, wanting to feel and look better about yourself, to people that are dealing with chronic pain and other chronic issues like migraines and things like that. That's. And and we were just talking basically for most people that listen know what I've been dealing with my wife for the last couple of weeks here. I'm a little nervous about doing some of the traditional migraine treatments and things for what you diagnose or think is something like that.
Yeah.
But when you go by like you said, a store bought thing, you could be doing more harm than you realize sometimes. That's why they say consult a physician before.
On every single box it says that in big bold letters.
You know why. But really this could be, for some people, maybe the migraine thing, this is that answer for them. But if you're one of those folks that like you said, they just, you just are naturally a sweater. I get it. I know when I was younger, not so much now as I gotten older, I've kind of, adapted, but like feet and dudes. I don't know, feet and dudes, they're not supposed to smell good. I don't know what it is, but.
Have you gone to a dorm before?
You're right. But I'm thinking, for someone that's got really bad problems there, a couple of the treatments with Botox could basically eliminate that problem, and you spend a lot less money on socks and odor eaters. So, and same thing with, if it's the armpit area, how many shirts get ruined? How many, and just think the self-esteem side when, I got a big job interview, you're already nervous. And so if your body's reaction is to sweat sweat profusely.
Yeah.
when you then you're like, well, man, I'm never going to get the job because I look like I'm always scared all the time.
Like I just came out of a rainstorm.
Yeah, I get it. It can be a debilitating, just socially or psychologically thing, even if there's not, a medical condition per se, other than it's a minor inconvenience. But and you probably have to drink a lot more fluids.
Yeah. And so with the hyperhidrosis, it is a medical condition where our body naturally needs sweat to regulate its temperature.
Sure.
I mean, that's what sweat is for.
Sure.
But some people produce excessive amount of sweats in those areas, and so what Botox does is it goes in and it blocks those nerve signals to the sweat glands that prevents it from forming the sweat.
Okay.
And it helps them out. From the insurance standpoint, there are about 2 medications that we can prescribe to try it first. But by the time they come to you as a medical provider saying, hey, this is a real problem. I've tried every deodorant across the board, every soap. I'm changing my shirt 3 times a day.
They're burning our skin because they've got such powerful deodorants in there.
Exactly. So by the time they come to us, we now offer the Botox so that we can help you to where, if you come and get a treatment about every 4 to 6 months, it calms that excessive sweating down and it really changes their outlook on life and to where they're more social and able to go out and do things.
So does it cause that area that, depending on where you put it, like if your armpits...
Let's just talk about the armpits. Yeah.
Would those areas not sweat at all now, or would they sweat normally?
Well, it's kind of a pro and con. So depending on the amount you give, you can make it to where it doesn't sweat. But for the most part, you will still have a normal sweat.
Gotcha.
Without being excessive.
Well, you need to sweat because that, like you said, that's your body's regulating your temperature. Yeah. And if you don't do that, you're going to overheat or freeze or
exactly.
a lot easier than you normally would here. Yeah. So you got to be mindful of that.
And the treatment is fairly simple. We do all these therapeutic Botox treatments in the office, and you can just numb the area just very simply with a cream. It takes maybe 5 minutes to do both armpits, and the patients get great relief almost instantly. Okay,
so it's a little different than when you apply for like the forehead for.
Well, within the week, you should start seeing some improvement.
Good deal. Excellent. What and how is it something that you have to do because I know with Botox for like cosmetic side, you have to do it every so months.
You would do it about every 4 to 6 months, just depending on how fast your nerves regenerate. Because what we're doing is we're blocking those nerve signals.
Gotcha.
So depending on how soon those nerves regenerate. So going back to the Botox for migraines, patients come in on an every 13-week schedule to be getting the re-up on their Botox.
Okay. So it's similar. You just get on the schedule there and, follow along, and then it should, assuming you stay on your appointments and everything, should be good to go.
You should be good. And, coming from the TMJ standpoint, patients who clench their teeth a lot, when they're nervous or when they're sleeping, they're constantly having jaw pain if they're excessive gum chewers. So we can put Botox in your masseter muscles, which is right here, and we put a little bit in your temporal muscle here. And what that does is that calms those 2 muscles down to where you don't clench and tighten so much.
Gotcha.
To where that helps with that pain that you're having in your jaw area.
Is TMJ something that you can develop at any time, or is that something you're born with?
No,
or is
you develop it just because of your habits.
Gotcha. So it's all habit forming.
Yeah, a lot of times dentists treat it. They'll give you mouth guards that prevent you from clenching, different things of that sort.
Okay.
That's one of the other treatments. But when it gets to a point where they're wearing their mouth guard, they're still clenching during the day, or you chew excessively, we put the Botox there in the muscles, which kind of help not completely deaden, but weaken it to where you're not clenching so much.
Gotcha. Because I imagine at some point you're starting to wear down bone and things.
Yeah, you can wear your teeth down, and so your dentist will say, hey, your teeth are kind of getting flat back there. Are you a clencher? And then that's when they give you the mouth guard, especially at nighttime, to prevent that.
Well, and anytime you're in the head area, like anytime you have pain in one way, it seems to impact the whole head. So like if it's a jaw issue and then you're having jaw pain, that pain travels up your ears, and you know what I mean? And so it feels a lot worse than it maybe actually is.
Yeah.
And so why deal with that?
Muscles. Yeah. And so that's why I love the Botox for the TMJ as well, because that one as well, people come in, they have chronic TMJ, they hurt all the time, they go and open their mouth or go bite something, it's painful. So we put that Botox in those 2 areas, and they're good to go after that for a while.
Excellent. Yeah. And so these are great options for folks if you're, and that's because these are the kind of things that people deal with, and they're just like, oh, I'm fine. And then especially if it's a mom or a dad Or they're worried about the kids. I'm like, nah, don't worry about me. I'll be good. Let's take care of the kids.
I'll take care of it. Yeah. And then they don't want to wear their mouth guard, and they're just miserable all the time. And it's, come see me, and I'll give you Botox.
This is a simple procedure. You're in and out. Come in once every couple months or so here, and get on that schedule. And it's just like anything else you probably do in your life. When when you go to a gym membership or any other, you just sign up and go do your thing
and get it done.
Yeah, and it'll save you a world of headache and hurt, literally and figuratively here with the headache.
Exactly. Yeah. And then going on to the spasticity, from the stroke standpoint. So you can have a hemorrhagic stroke or an ischemic stroke, but one of the most common post-complications is spasticity.
Okay.
And what that is where your muscles contract, like they get so tight to where your arm flexes either at the elbow.
It's like freezes or something?
Yeah, it freezes like in the elbow, the wrist, the hand, the fingers, to where you're at a full flexion, essentially, in different levels of the arm or the leg as well. And what happens is the tendons and the soft tissues get frozen to where it becomes painful after a while. And it's most common within the first year of a stroke. So if you have physical therapy coming in, trying to help manipulate and open your range of motion of your arm, they can do a lot if they get on it right away. But that's where Botox comes in as well, therapeutic Botox, because we're able to go and loosen those muscles to allow the physical therapist to come in and help relax the arm and the hands.
Kind of like, say you got a slinky, for folks that remember slinkies, and it's like trying to play with a slinky when it's all tight and coiled up.
Yeah, when it's all coiled up, you can't stretch it out.
It doesn't go downstairs alone or in pairs or make a slinkety sound. It doesn't do any of that. But with the Botox, it allows, in essence, your slinky to come out and come in and stretch, and so which allows it to move. So that's in essence what that Botox is doing. It's going and breaking up that froze up muscle, basically, and allowing your joints and everything to do rehab and get you back to your movement and all that too.
Because that's one of the biggest things for the post-stroke is that patients end up becoming reliant on caregivers because they lose their ability to feed themselves, dress themselves, bathe themselves, all because they lose that full function of either one arm or the leg. And so if we can come in and help to where they can at least open their grip, relax and open their hand to where they can at least maybe pick something up, that gives them this huge, quality of life improvement on helping them to where they feel much better and trying to get some of their independence back.
I would even imagine too, it's just the mental side of it, where if you're not seeing results in your rehab there, or feeling like you are, you start buying less into the program, and you're starting to less likely to show up and do your rehabs and things. Whereas these Botox injections could actually give you the results you're looking for. And it's like, okay, these Botox along with my rehab, now I'm getting as close to full motion of my joint or whatever it is I lost in the first place. And it gives it's kind of like one needs the other to really give the patient that full success story.
It covers all the bases, and people don't realize, but 25 to 40% of patients have spasticity after a stroke. And that's terrible numbers. So if we can help you and work as a team, between the doctors and the physical therapists and therapeutic Botox, that helps tremendously on improving the quality of life.
Sure. Well, and I think we all know we have family members or something when people hit those certain milestones where they lose those abilities, life in general just tends to go downhill because, maybe depression, maybe all the other issues that start creeping in. It's like, well, I guess I'm stowed up. I'm not moving. I'm old. I'm useless. And then all of the mental health stuff starts coming in. So I'm not trying to put like this, major, this is going to save your life, but in reality, this is that type of thing that could be the difference between someone going to care and fight through and versus I'm just getting old and I'm giving up. This might be that difference
Change.
Maker to allow that to happen, to keep people wanting to pursue and fight and enjoy life again.
Yes.
So.
They start seeing the results, and again, just like the other Botox, you have to do it continuously. But on the dosing of it is kind of more of a trial and error. We start conservative just to see what we get as far as relaxing that muscle, and whether it's the arm or the hand and the fingers. And then, I always want to explain to patients, hey, if it's not enough this time, I'm going to be seeing you back and we're going to do a little bit more next time. But we want to titrate it to the dose that gives you that freedom of opening the range of motion and being able to utilize, hopefully, your arm, you know, in the near future.
Yeah, it's all all right. It's kind of like, you know, when you make something the first time, all right, add a little bit more liquid. Yeah, that's still too dry. Let's add a little bit more. It's no different than that. She's basically just, all right, let's put a little in and see how your body reacts. And if it reacts positively and it doesn't cover what we need to do, then we can up it. If it happens to be enough, then awesome, we nailed it. But exactly. But that's really what's going on there. And so if you don't get if you don't get, you know, super positive results first time, there's other things. We're just trying to see if we're going in the right direction with your treatment or if we're way off base here.
Yes.
And that gives you that indicator. So.
Yes. And so that's why I'm really excited about promoting it, is just to let people know that, hey, if you're having this issue, there's options for you. If you're not getting, you know, you're doing the therapy and you're just not getting those results, there's more options to try. And people don't think about Botox. You know, they don't really realize that it's therapeutic. And so that's why I really love promoting it on this side of it.
Sure. While we're talking Botox, I kind of want to get back to the headaches just real quick.
Yes.
And, can you explain what qualifies as a migraine versus a regular headache? Like, people that get just frequent headaches, are those part of migraines, or is that a different? I know there's 100 possibilities when you get a headache on what it could be, but what is that major delineator that's a migraine versus just a garden variety headache?
So from the migraine, it's debilitating. So you have the light sensitivity, the sound sensitivity. Most of the time, a lot of women or men will have nausea with it. They physically have to go into a closed room.
Light sensitivity.
Yeah. And so it's the debilitating side of it. So a minor headache, you can still function and do your job. But a migraine will knock you down to where you have to physically remove yourself from whatever you're doing.
Okay.
Go lay down, try and close your eyes, relax.
So the difference is the pain level, basically.
Correct.
If it's one where you can't, you know, be in a room that's bright or noises and all that's impacting, you're just like, ugh, then that's probably more in the migraine territory versus.
And then from the Botox, they require, from the insurance standpoint, at least 8 migraines a month. So you can have a daily headache, but they want you to at least say, hey, you know, I have a regular headache all the time, just a gnawing ache all the time.
Sure.
But it turns into a full migraine at least 8 times during a month.
And each person's different on that. Some, they get them for maybe a short period of time. Some, they're done for the day. You know,
or
it's like
several
they get
days.
Yeah. So it does vary on the debilitatingness of the migraine. But if you're seeing or experiencing light sensitivity, noise sensitivity, nauseous, all that, then odds are pretty good that that's a migraine territory. So you need to lay down, or at least, you know, go in a cool, dark room and just shut the world off. That's what a lot of folks that suffer do that. So.
Yeah, and then they'll take, you know, the over-the-counters, but it's one of those things, kind of like what you were mentioning with your wife, is always go make sure with the healthcare provider that it's not anything more serious before we just kind of write it off and take ibuprofen or Tylenol.
Well, and that's the thing. It's kind of like COVID. You know, you hear the symptoms and you're like, yeah, that sounds like a million things. Well, headache is a symptom for just about every human affliction out there.
Yes, everything.
So just because you have a headache doesn't mean it's migraine, and doesn't mean it's serious or not serious, or it could be. It could be, you know, and you know, my wife and I we learned this firsthand here over this last month, but yeah, it's not. But at the same time, don't run around, because I've heard this too, where I've got a bunch of friends now, because we really don't know what caused this, that are like, every time I bump my head now, I'm nervous, I'm going to do it. And it's like, well, live your life. Don't do that.
We don't want you to be in a bubble either.
But just be aware that, you know, when something doesn't seem normal, don't just chalk it off as a bump and bruise. Maybe have an expert look at it and determine whether those headaches are migraine, or, you know, you just got a cold, or you just stress out and you need to, you know, take care of yourself a little bit.
If you have a headache, you know, one day every couple of months, it's probably from stress or something else going on. But when you have the criteria is when you have worsening headaches, like it's not going away, you're taking over the counters and it's just continuously every day, that's when you need to seek attention. Because a lot of times, if it's just a migraine sporadically, it's probably just a mild headache. But if you're getting full migraines and they're becoming more progressive, then you need to get that.
Is there any kind of family history? Like if you have family members that get migraines and stuff, does that increase your odds, or is there any of that?
It could. I'm not exactly sure on the statistics on the hereditary side of it,
Gotcha.
but it is possible where my dad always got migraines and I get migraines, but that's where you should still get it checked out.
Okay. I just didn't know if it was more of a lifestyle thing that causes them, or there's a DNA thing that causes it.
A whole multitude of things.
The answer is yes.
Yes. Anything you want to come up with, Mike? Yes.
Aliens, uh-huh.
Yep, there you go.
Ninjas flying from, yes.
Yeah.
Cheeseburgers, uh-huh. Silent killer.
Yes. Yeah. So there's more information on going back to the stroke side with the spasticity. If you go into the American Stroke Association online, they actually have a full, first thing on the top of the page is a full breakdown on spasticity and different treatments, and then obviously talks about Botox on there as well.
Yeah.
So I was kind of excited to see that on there, you know, kind of promoting it from their end too.
Gotcha. I know I'm jumping back and forth, but back to the perspiration and things like that. Is there like an age limit on that where you're kind of, because I know, you know, teenagers and things want it, but is that a good area to start with them, or is that too young? Or?
No, if you have excessive sweating, so there's an actual classification, like a scoring system.
Okay.
So if you have excessive sweating and you meet the scoring system, then you qualify for it.
Okay. Because I didn't know if part of that's just growing up, because teenage boys sweat and
they do
spew all kinds of stuff.
But that's where, you know, you want to talk about deodorant and, you know, hygiene.
Sure.
And
this isn't the first line of defense here. This is after several of trying other things, deodorants, you know, things like that. But when you just get out of the shower, put your deodorant on, and then put your shirt on, and then a half hour later you're dripping and sweating, you didn't go to the gym or nothing, then maybe this might be something that we need to talk to an expert about.
Right, right. Yeah, and so that was, you know, that's one of the things that girls especially are very self-conscious about. You know, boys are used to it. How you kept talking about, you know, they work out, they excessively sweat. But girls are a little bit more self-conscious because they don't want to have the sweat.
They don't sweat, they perspire. I remember.
Right, yeah. You know? And so, you know, you'll see this a lot more in the younger girls wanting to get this treated.
Sure. But I think it's, you know, equally because, I remember back in, you know, when I was in my 20s and stuff and sweated more and stuff. And, I had there was a couple of those, you know, days you wake up and you put your shirt on and by the time you get to your job or whatever, like, dude.
Oh, gosh. Yeah. You know, I did my schooling in Miami, Florida, so it's humid all the time. So imagine driving to school at 8 in the morning and you're already sweating because of humidity.
Yeah.
But this is excessive sweating.
Yes, this is where, like you said, it was like you're just sitting there and you got pit stains that are showing up and you're not really exerting yourself or doing anything to cause your body to need to cool down in those areas too. And so if you have those problem areas, I'm guessing, you know, your feet, hands, probably behind the knee. That's probably an area that probably gets a little common for some folks too.
Yes.
And then your armpits, things like that. But definitely, please talk and that's just it. That's where you need to talk to Sarah, the expert here, because she can tell you, no, that's just garden variety. You know, we can Botox is not. You're not there yet. Let's talk about, you know, changing your deodorant or doing something like that. But, you know, that starts the track record. If that's not giving you what you need, then Sarah, all right, let's start with a little Botox. And like we said, and who knows, because we don't want you to just turn into the Sahara there and start overload. And next thing you know, it's like my arms won't move because there's no friction from.
Well, from the hyperhidrosis, it is pretty much a set dosing that we use on the armpits that have been studied to work well on the sweat glands. From the stroke side with the spasticity, it is a tighter dosing.
Gotcha. It depends on how.
Same thing with the cervical dystonia with the neck spasms. It's a tighter dosing.
Now with the stroke, for folks that are recovering from stroke, can you do it pretty much anywhere? I mean, wherever they're experiencing.
Well, right now it's just approved for arms and legs.
Okay, I didn't know if there were any kind of facial stuff that they can help with that. Or...
I mean, you'll have the facial drooping and so forth, but that's not where the Botox is going to help you because it's already weakened. Okay. And so you got to realize what Botox is doing is it's weakening the muscle.
Gotcha.
And so it's more where you're having the contracture of a muscle that you want to put it.
So it'd be the opposite. make it droop worse.
Correct.
I gotcha. Okay. Yeah, makes sense. Yeah. That makes sense now. Yeah. When we got to wrinkles, and I'm like, oh, maybe. I don't know. Maybe to go this way. Tighten up one way and go this way. I don't know. But
right.
But point is, if you're dealing with any of this stuff, if you got issues from stroke, just being stowed up in your arms, legs, things like that, this can help. Sweating, if you got that's an issue, please see her. And then, of course, if you have migraines or I just want my face to look a little nicer.
There you go. I do that on the side as well.
All of the above can be done.
All of the above, yes. And then the neck spasms, we talked about that last time with the cervical dystonia. If you have chronic neck spasms, the Botox takes care of that as well.
Gotcha. And by the way, it's pretty... it's not that painful. It's a very simple little procedure. It's not anything, because I know, here Botox and it's the little needle injections for the cosmetic. It's just a little pinch, essentially. I call it spicy. Yeah, it's kind of like acupuncture. Like, when they do, they put the little neat pins, you don't really feel those when they put them. It's the same in that ballpark. It's not like a tattoo or something.
Yeah, no, it's not painful. Yeah, it's not painful.
Yeah, exactly. But if you're experiencing any of these things, please call her office direct, set up an appointment. You can reach out to Sarah at Lovelace at 575-627-4200. Again, that's 575-627-4200. Or stop by the Lovelace Healthcare Center, 1112 North Main Street there. Yes. Not the hospital.
Not the hospital. We're in the clinic.
In the clinic itself.
On Main Street.
So, but you can walk to the hospital to get the burritos. Yeah. So no burritos in the clinic. Sorry. Of course I'm going to say it. They were waiting for it.
I know. You and the burritos. I still have not received a burrito from you yet, Mike. Come on.
They're pretty good. Yeah. They're really good. They're... you know what? If you got wrinkles in your belly, they'll smooth them right out. You eat enough of those things.
I guess you can look at it one way. I'm not promoting that. That's all, Mike.
You'll die happy at least. But definitely call, schedule an appointment, set up a consultation with Sarah East.
Yes.
She can sit down and go and tell you exactly, even if maybe Botox, you're not there yet for that. She can definitely start you on the process and say, all right, let's try this, and this first.
Yes.
And if that doesn't see the results we want, then let's get you into the Botox. Let's start that process, and who knows. Do you ever get folks that actually use Botox for multiple, like, hey, I got headaches, but also trying to get the wrinkles? I mean, do you get, is it a two for one kind of deal for some folks?
Naturally, when we do the Botox for migraines, we are treating the frontal area. So you already are getting that treated just from the therapeutic side. But there is if you talk to an esthetician, there is a huge difference between placement of Botox for the wrinkles versus placement of Botox for the migraines.
Gotcha.
So the
location.
Exactly. And so the way Botox for migraines is placed, at set certain locations that you have to do 155 units around the head.
Okay.
But for cosmetic, there's an actual technique of placing the Botox to where you don't affect, the eye or anything.
Does it is it like for headaches and things like that? Is it more about pressure points and things, or does that not come into play?
No, it's for migraines.
Okay. I didn't know if, all right, we inject near the pressure points. That does a certain, I don't know. I'm confusing my Eastern and Western medicine, I think. This is why I'm a DJ and not a doctor. Don't take medical advice from a DJ. That's just saying.
Okay.
And
conversely, you could be the next Dr. Phil or something.
And conversely, don't take radio advice from a doctor. Just saying, go where the experts are. She can't help you get a commercial on the radio.
No,
but, I can't help you, with anything else.
No. Yes.
But again, reach out to Sarah's office, 575-627-4200, or come by 1112 North Main Street at the Lovelace Health Care Center there, and inquire about any of this stuff. And of course, if that's not your problem, but there's something else,
primary care.
There's many other physicians and specialists that can help you there in the building too. So don't hesitate. Just go. Is y'all's website? Is this Lovelace.com? I don't remember off the top of my head. It's Lovelace. If you go to Lovelace.com, you can see all of the different services that Lovelace covers here in Roswell. And so if you need a knee replacement or want to have a kid or something, they can help out with all those things.
And we have cardiology as well now, so
we're
very excited about that.
Their heart is back.
Yes. We have the heart back.
Good.
Yes.
Again, one more time, 575-627-4200, or stop by 1112 North Main. And while you're there, bring Sarah a burrito from the hospital. It's just,
So I can finally agree with you.
Yeah, it's really good. It is. It is. You're gonna want another one. I don't know what it. Ask that chef. I don't know. I don't know if they just pay him so much that he never wants to. Because I feel like he could go to like some like Michelin restaurant or create his own Michelin restaurant and do something.
Yeah.
So.
Well, Brian was agreeing. There is a special touch on it.
Yes.
All right.
Well, did we get anything? Is there anything you wanted to mention that we?
Nope. I think we covered all of it.
Awesome. Well,
yes.
I'm sure you got a bunch of patients waiting for your help right now, so we'll let you get to work.
Thank you.
Thank you for spending a few minutes with us here. Sorry we kept her late, guys. She's coming.
Yeah. Thank you so much,
Thank
Mike.
you, guys.
I appreciate it.
We'll see you next time.